Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. Today we're looking at high quality care for patients with chronic lymphocytic leukemia, or CLL. About a quarter of new leukemia cases are CLL. The good news is that oral oncolytics have drastically improved treatment for this patient population. But with that comes new challenges for the care team to manage. Things like adherence, patient involvement, financial issues, toxicity management, and more. Nurses manage these barriers by engaging patients in shared decision making to create treatment goals. Today's guest is Amy Goodrich. She's a nurse practitioner at the Johns Hopkins Kimmel Cancer Center in Baltimore. It's nice to have you here, Amy. Can you explain the nurse's role in medication management and adherence for patients with CLL?
Right. And so nurses play a very key role in that medication review, making sure we understand what medications patients are on to be able to assess for those drug-drug interactions, but also education, making sure that patients understand what therapies they're receiving, what side effects they are expected to have, and then doing that on an ongoing basis.
How can shared decision making help patients face barriers to care?
So in CLL, shared decision making is so critical because basically patients, especially with oral drugs, they have choices between open-ended therapies, so our BTK inhibitors that are given long-term until progression or unacceptable toxicities, or finite therapies where we give a BCL2 inhibitor with an anti-CD20 monoclonal antibody. And those are either 1 year or 2 year therapies. So those are finite. And so the finite therapies tend to be a little more intensive initially with infusions and lots of blood work, lots of visits. And, the open-ended therapies tend to be a little less intense with visits. So that's where, the patient, depending on what their transportation status is, are they still working? Can they make all these trips back and forth? Do they have the time, the transportation? Those are the things that are so critical because we have great, great oral therapies. There is no wrong answer. And that's where tailoring the therapy to the patient is so critical.
What tools do you recommend to care teams who may see very few CLL patients annually?
Oh, that's a great question. Certainly I always say to people, look at the NCCN guidelines, right? Don't assume you remember any of it because they change very often. If folks are not super comfortable managing CLL patients, it is fine to refer them to an academic healthcare center, get a second opinion. You can figure out if there are any trials that patients are eligible for. But all of these oral therapies that we give to our CLL patients, they are not CLL specific. So we're using them in other hematologic malignancies. So even if you're not using the drug in a CLL patient, many times you're familiar with that drug from other types of hematologic malignancies. So just really harnessing your experience with the drugs and not being afraid to refer people out and get another opinion. And then, they come back and you treat them with what, was decided at the academic healthcare center. That's absolutely fine.
How do you see the nurse's role on the care team growing?
Oh, so our number of oncologists is we've been short oncologists for a long time. So certainly nurse practitioners, other advanced practice roles really fill that gap. But our oncology nurses are such an important part of the care of these patients with, just being the day-to-day touch points for these folks and really knowing how to engage with patients and really flesh out what's going on with them. A lot of times patients are afraid to tell the physician what's really going on. And this is where all of these nursing roles are so important because it's less threatening for patients and we can really get to things quickly that could get out of control.
What advice do you have for your colleagues who may not have much experience treating patients with CLL?
Yeah, I think just don't be afraid to use oral therapies. Just get in there. If you're not using them, just start using them. It's okay to figure it out as you go, and you'll get a well-oiled machine going. We all had to start somewhere, and we all got better as we went. And so that's really what I would encourage practices to do: is just dive in and use these drugs, because they are really very efficacious, well tolerated, and really have made such a difference for this patient population.
Thank you, Amy. Cancer Buzz TV is a resource of the Association of Community Cancer Centers for the busy multidisciplinary oncology professional. Today's episode was made possible through support from AbbVie. If you'd like to learn more about integrating oral oncolytics into CLL practice, you can check out the links in the show notes. On behalf of all of us here at Cancer Buzz TV, thank you for watching. I'm Summer Johnson.